ER 101. Get the 411 on your 911. Here's your host and emergency room physician, Dr. Leigh Vinokur.
Hello, and welcome to ER 101 from the American College of Emergency Physicians. I'm Dr. Leigh Vinokur. Well, you know, the CDC just had some new data out that said children make up 25% of the 130 million emergency visits that we see every year today. So here to talk about the most common pediatric emergencies and how you can avoid them is Dr. Chris Amato. He's assistant professor of the Department of Emergency Medicine at Mount Sinai School of Medicine in New York, and he's the past chair of the pediatric section for the American College of Emergency Physicians. Welcome, Dr. Amato. Thanks for being here.
Oh, it's my pleasure, Leigh. Thank you for having me on again.
So, yes, he's a frequent guest and a well-known expert. So, Dr. Amato, let's first talk a little bit about even recognizing emergencies in children, because especially small children that don't talk yet, you know, I always thought it was a little bit like veterinary medicine too, because you have to decide what's an emergency because they can't tell you. So what are, you know, some of the ways that parents can pick up, I mean, everybody knows their kids, but how can they pick up what's going on with their kids and when it might be an emergency?
Well, I think that's an exceptional question and one that a lot of parents always wrestle with. You know, should I come to the ER? Should I call my doctor? Is this worth it? Are they going to think that I'm silly for calling? You know, it's important that they recognize, they're going to recognize when their child is not themselves. They know when they're not walking, talking, doing things that they have seen as a pattern, you know, for months or even years, that just the kid's not fitting at that point. So there are obviously specific things that can certainly generate more and more concern, but and those being a high fever or multiple episodes of vomiting or diarrhea, some kind of fluid loss, headache, a severe headache that certainly that the child is not acting well. You know, there are certain things that should trigger
Right.
automatic calls to their pediatrician, their primary physician of any kind, or even potentially just a trip to the emergency department. But I think that you just said it, is that parents know their kids. And when something is triggering that little hair on the back of their neck to say, something doesn't seem right, I think that more often than not, they should follow that instinct and, you know, contact somebody.
Yeah, that's a very good point. And, you know, you also brought up another good point that I like to tell people, because myself, you know, I always say, even when my son was sick, and I once wrote an article on it, everything, when it came to my own son, you know, everything went out the window that I learned in medical school, because, you know, it's so emotional. So I try and tell moms, there are no stupid questions. There are no stupid concerns, you know, and I think that's really important that moms and dads should realize that it's hard. You're emotional. It's an emotional time. You're really worried about your kids.
Absolutely. And I will tell my families all the time, listen, I would rather see a child 1,000 times and know that they're safe than miss the one time that I should have seen them. So anytime they're concerned, I'm already concerned. And you know, I think the most important thing that we do as physicians, especially if we're taking care of children, is to remember to listen to the parents and understand what they're trying to tell us and their concerns, and then act from there, besides, of course, examining the child. So oftentimes in pediatric ER, we don't just have one patient that we should be listening to and paying attention to. It should be just, you know, it's upwards of 2 or 3 or even more, depending on who's in the room.
Yeah, who's the caretaker. So you brought up some good points. So, you know, behavior changes, if they're like too sleepy or too alert or cranky, those kind of things can tip parents off that something's going on?
Absolutely. You know, the changes from norm, changes from that baseline is what we're looking for more often than not, is that there's just something out of the norm, whether it be a higher temperature or a lower temperature, or, as you've indicated, sleepier, or just fussy and not sleeping, you know, just can't calm down. I remember clearly, and just like you said, that it's completely different when you're a parent and you're a physician. My son was 6 weeks old, and he just would not stop crying. And this is the child who should have won the colic of the Century Award, but he
I
just
had
wasn't
one of those.
himself. You did, yeah. We all do in some way, shape, or form. And he wouldn't stop crying. And and the pediatric emergency doctor inside me said, this is okay, it's all right. But the parents inside me is like, come on, this is not normal. And we put him in the car and we drove him. And I swear to you, within one block of the pediatric ER, he finally fell asleep and calmed down. And it's just like, oh, he knew how close he was for me to for me to talk to my attendings about something else. So
yeah, it's true. When it is your own kid, you're so emotional. That's what I said. Everything I learned in medical school goes right out the window when it's your own child, because you're just like, what?
Absolutely.
But yes, so that's a good point. And also, little kids are different. So breathing is an important issue with kids, right? I mean, they don't fall down and have heart attacks. So when something really bad happens with their heart, it's usually they've had breathing issues before that time. So is that something to look out for?
Absolutely. In fact, actually, 80% or more of cardiopulmonary arrest in children is related to respiratory, or is in some way, shape, related to their breathing or their airway. So for children, the most important thing that we focus on in the extreme child and the ill child is making sure that they are breathing comfortably and that airway is open and patent. And you're absolutely right. There hasn't been any 7-year-olds that I've taken care of that have felt their left arm numb and kind of keeled over in the sandbox.
Not yet, but the childhood obesity, the childhood obesity statistics are going up. Probably like 30 years from now, we'll unfortunately see kids.
I'm hoping to be retired before that becomes the next issue of adult diseases that children get, which unfortunately is a reality.
I know, it's so sad.
But they do present with anything that has to do with their lungs, anything that has to do with the airway. Gosh, I want to see them. I want to make sure that they're safe, that they're breathing, that they're oxygenating well, that if there's any interventions that need to be taken care of, that we address. And when it comes to a breathing disorder, I would rather see them now as opposed to 2 hours from now, because in children, that could be a huge difference. People get freaked out about croup, and honestly, they should to some degree, because croup is an upper airway swelling that can become life-threatening. And just like asthma, people are like, well, it's just an asthma attack. No, that could be life-threatening. So when it comes to the airway, when it comes to the breathing system, I'm much more aggressive in those children than just saying, oh, you're fine. But I have the luxury of that parent bringing the child to me, and so I can see them. I can see how they're acting. I have vital signs that I can review, as opposed to the primary care provider who just potentially is listening to them on the phone. So in those instances, I like to think of myself as just their hands. I'm the next evolution. I'm that safety net so that they can see that child and make sure that child is safe for the evening until they can be seen in the office the next day. So,
right. And along those lines, so when you talk about breathing problems in kids and such like that, some of the things, there are some potential emergencies that we kind of see all the time that you can prevent, and one of them for kids 3 to 5 is choking, right? So you have
Absolutely.
to think about that around the house. So what do you tell parents about that, or how to prevent it if we're looking at preventative things?
Well, I mean, so children are very curious and very intelligent creatures. They first want to imitate whatever mom and dad is doing. So when they see the dad come down in the morning and they're kind of bleary-eyed, and the first thing that they do is pour this liquid into a cup and then drink it, the child wants to emulate that. So not only are they exploring their environment, but they're also doing kind of a pattern recognition. So they are going to try and simulate that. So they're going to grab for things on the countertops. They're going to grab at objects. So you got to make sure that the environment is safe for them.
Okay. Well, that is good advice. This is ER 101. I'm Dr. Leigh on Radio MD. Stay well.